At this stage, we are hearing reports that there are more than 20 million people affected by the flooding so far. And as rains continue in the days to come, it is expected that that number will increase. There's also many communities that we haven't reached yet, and so the scale of this disaster is really only going to become evident in the coming days. 20 million affected essentially means that there are 20 million people that are in desperate need of some kind of assistance. We know that there's been more than 1 million houses that have been completely destroyed, and those will have to be rebuilt, and more than 3.5 million children who are in dire need at this stage. As a result of this flooding, the biggest challenge for the people of Pakistan is clean water, and the risk of increased diseases that we are seeing. There are reports of cholera, and that's a disease that will spread very quickly. Access to food is another very big issue at this stage. Markets have been flooded, and food is not reaching those that need it most. World Vision is responding right now with providing food and non-food items. We've been able to reach 21,000 people to date, providing food mostly in schools and on roads where people have been displaced. We have also set up 5 emergency health clinics, and we are treating primarily women and children, looking at a lot of respiratory and diarrheal diseases at this stage. In the coming days, we are looking at targeting more than 40,000 households, which translates to about 280,000 people. I'm leaving for Islamabad tomorrow. We'll be spending the next 3 weeks working with our national staff to help design our response as the situation continues to evolve by the hour. We'll be doing a lot of work to coordinate with the United Nations and with other NGOs to ensure that we're not duplicating efforts and that we are reaching the most vulnerable. Yeah, I think the situation in the next few days and weeks is going to be quite a struggle for the people of Pakistan that have been affected by this disaster. They're facing an increased risk of disease, and so that's a very big concern. It is true that eventually the rain will stop and these waters will recede. But the issue is that there is going to be a significant amount of recovery work that is needed. Families' entire livelihoods have been washed away. All of their possessions, anything of value that they had, including livestock and crops, have been totally destroyed. It's going to take many years, really, to be able to rebuild after the destruction that these floods have caused.